coronavirus outbreak. In addition to Dr. Smith, I've had regular conferences with the Vice President and his team, including the CDC and the officials at Health and Human Services. Late yesterday, I spoke to numerous governors on a call these governors have had multiple confirmed cases in their state. One particularly struck me as informative. The governor of Massachusetts, my friend Charlie Baker, was telling me that of the case of the Biogen executives that attended a leadership conference in his state. So this is a company leadership conference, and there were about 175 attendees. Out of those 175 attendees, there's been 70 confirmed positive or presumptive cases out of that one conference. And that tells me that one positive case leads very quickly to can potentially lead quickly to other positive cases. And that close contact at that conference certainly impacted the 70 confirmed cases that are currently in operation. And of course, the elderly are most at risk, and they're the greatest concern. And today, I've talked early today with Dr. Smith, and the Department of Health have confirmed Arkansas's first presumptive case of the coronavirus in Arkansas. I say it's a presumptive case because the testing has been done by the Arkansas Department of Health, and we'll now send that to the CDC for confirmation, which is our routine practice. This case is a patient in Pine Bluff. The patient has had a out-of-state travel history. The Department of Health has dispatched a team to the hospital where the patient is in isolation, and there's not any general risk to the public, but the Department of Health team will be taking the proper precautions there as the patient is in isolation. But this is, again, our first case in Arkansas, and that has triggered a number of important initiatives that we need to do as a state. I've directed, as I've said, each cabinet department to review their plans to make sure that we are prepared. Each plan was presented to us today, and essential state services will continue in the event that the coronavirus is beyond what we see right now in our state. At the current time, there's not a need to do all our work remotely. There's not any need to disrupt our state services. Our business will continue as usual, but we are prepared in the event that there is a necessity of it to go into more remote operations to continue state services. We're encouraging all employees to stay home if sick or having flu-like symptoms. In addition to those steps, I have implemented a new travel policy for the next 60 days. There will be no out-of-state travel without the approval of a cabinet secretary. The approval will be based upon guidance from the Department of Health and the urgency of the travel. And I'll emphasize that travel can be different under different circumstances. You could be traveling in an automobile to a particular destination and coming back. There's not any risk associated with that. It could be to a not affected area. And so those are decisions that should be made on a case-by-case basis. It's not a complete travel ban because we want to continue business. We want people to continue doing business with Arkansas, just as they do in the private sector. So work will continue. But we do want to take that appropriate precaution to ask the cabinet secretaries to approve travel for their employees out of state. In terms of the public, in addition to the normal preventive measures, I'm concerned about upcoming travel plans by Arkansans. Spring break is fast approaching, and travel plans have been made for trips across the country and the globe. I urge Arkansans to rethink, to reconsider every trip out of state. Ask some simple questions. Is it to a state or area with confirmed cases? Does the trip include large gatherings with other people from multiple unknown locations? When you return, will you have contact with the elderly or with other large groups? Are you driving or going by mass transportation? Are there safer options for the vacation? These are reasonable questions that Arkansans should ask themselves as they look at their travel plans for the fall, very similar to the questions that we'll be asking state employees if there's travel plans necessitated by work out of state. I've been asked about our state plans. I hope that you can see that we have plans in place. We don't discuss all the plans because it's not necessary under the current environment. We take this a day at a time. We hope that we'll continue to mitigate the risk from the coronavirus, but we have plans in the event that it is a larger challenge that we face. Everyone should know that we are prepared as we can be for the future and any upturn in the outbreak, and we will be continuing government services under any circumstances. Today, I'll be signing an executive order declaring a public health emergency in Arkansas as a result of the coronavirus case that we have a presumptive confirmation of. And we have an emergency order that's been prepared for my signature that I'll be signing later today. You'll be provided a copy of that does address a number of emergency measures that are important for continuing business in the state, for going about our activities as normal, but also giving our managers, our responders, the authority that they need, as well as the extra resources that they might need, and to cut through red tape that will allow them to address the current circumstances. Health experts say that we are nationally past the point of containment and we've moved to mitigation. And so we're doing that here in the state of Arkansas. Thankfully, we don't have what some other states are facing right now, but we want to be as prepared as we can, and we need the public's health to do that. And now I'd like to ask Dr. Smith to make comments from a public health standpoint.
Thank you, Governor. First, I'd like to say that the report of the first presumptive positive case in our state was not unexpected, in that over 30 states have already reported cases, including most of the surrounding states. And so we were prepared for this possibility and are acting on it. Second, although this is a presumptive result, we're moving ahead, identifying any potential contacts, monitoring them. We will test any who have symptoms, and we'll be moving ahead to gather more information. And third, at this point, we don't have evidence of spread within the Pine Bluff community or cases elsewhere in the state. As the governor mentioned, based on the information we have at this time, this infection was likely acquired through travel to another state, and we will follow up on any contacts within the state. And we'll continue to keep you informed of the progress and what additional findings arise.
Thank you, Dr. Smith, and thank you, Dr. Smith. And with that, we'll turn it over for any questions. That is correct. We're still looking at the complete travel history, but that is the preliminary information that we have on the travel history, that it was associated with out-of-state travel. I'm not aware of any international travel at this point. We'll continue to look at that travel history. Dr. Smith?
We really have very limited information at this point. This test, this presumptive positive was just reported this morning, so we're still gathering information.
Also, with the public health emergency, and generally, I know you talked about restrictions on travel and guidelines on travel for employees, but also non-employees. Any restrictions you think need to be taken in terms of large gatherings or events in the state?
No, I do not. I think that in Arkansas, with the limited exposure that we have, with one case, only one case that is presumed positive, There's not any need for canceling events. I do not see any need for canceling school activities, and I certainly don't see any need for having any change in school education as it continues. And that's one of the things that, as I release the emergency public health executive order this afternoon, please pay attention to how we handled the schools, because we want to make sure that we make decisions in terms of school and attendance at school and school activities based upon good guidance from the Department of Health. And so that will be coordinated closely on recommendations in regard to school activities. But at this point, school continues. There's not any need to cancel activities or any other public events.
Has there been any change in protocol or giving any directives to any of the airports in the state?
No, of course, the airports have their own screening mechanisms and their own health protocols. I know that there's probably been a decline in passenger travel, and I would expect that the federal government, just as they look at the cruise lines and their lost revenues as a result of this, that they'll be looking at the airlines as well, and what needs to be done to make sure that they remain economically and strong, even with this downturn in travel activity.
In terms of the gatherings, what about gatherings here that bring in a large number of people from outside the state?
Again, I don't see any need to restrict that. Obviously, if we are having we discussed this at our cabinet meeting today, if there was a conference that was coming up or a meeting that was coming up where we were having travelers from South Korea, then we need to rethink that. And so that would, I want our cabinet secretaries to make good judgments on that in coordination with the Department of Health. But from a state standpoint, we have not canceled any gatherings, any meetings. We want our economic development growth to continue. We have prospects coming into Arkansas, and we're obviously going to maintain the normal health anti-flu type precautions that we're asking the public to engage in, and we will engage in that, but we're going to be doing business in Arkansas.
Dr. Smith, how many tests is the health department capable of cranking out per day?
We've recently increased our capability. Right now, we have the capability of doing at least 20 a day, but the commercial labs are coming on board. LabCorp, for example, and is able to do those tests as well, and they're reporting results to us. As time goes on, I would see that more and more of those tests would be done by commercial private labs, and that our lab would be doing more confirmatory testing.
What are the criteria to qualify to be tested if you have concerns?
Let me just first say, before Dr. Smith answers that question, that I've asked Dr. Smith to lead the effort in enhancing our capacity for testing in Arkansas. That's a nationwide need, but there's more resources that we can bear on that. We want to make testing available for those that show symptoms, and we want to have it more broadly available. Dr. Smith.
I agree.
Criteria?
Well, the criteria right now, if a physician wants to have their patient tested, if they are suspecting COVID-19, they can order that test, collect the specimen, and send it to LabCorp or another commercial lab. So there's not a specific criteria that's required for that. There's not really much point in testing people who don't have symptoms, though, because the results of that test are not very meaningful. If someone doesn't have symptoms and you test them and they test negative, that doesn't mean that they haven't already been infected and will later on develop a positive test. So it would really be most useful for someone who has symptoms and has some risk factors or has some symptoms that are more specific for COVID-19.
What's the timeline on getting that presumptive test back from the CDC?
We will, I can't speak for the CDC. I know they're doing quite a bit of testing. In the past, it's taken sometimes a few days. We're going to go ahead and act as if it's a true positive. I have utmost confidence in our public health lab. Since this is our first positive report in the state, though, it is our protocol to get that confirmed by the CDC.
Have any of the other persons under investigation been in contact with this one confirmed case?
We're still gathering information. As far as we know, no.
With that, thank you very much for joining us today, and I want to thank our cabinet for leading Arkansas so well and for meeting the current challenge. Thank you very much.